Hi, I'm Carolyn Cross, Chairman and CEO of Ondine Biomedical.
And I'm Leanne Carlson, Clinical Training Manager and a practicing dental hygienist from Saskatchewan, Canada for 30 years now.
Leanne has been working with Periowave for the last 5 years, and I'd like to ask you the question, what does this do for your practice?
Well, Carolyn, first and foremost, I think the thing that we can say is that it's made our patients healthier. There's so many other benefits, but number one, we're seeing in the health of our patients, the periodontal health of our patients, so much better. What it also means for our practice, because it is a periodontal surgical practice, is that we no longer have to do 4 quadrants of surgery. We can actually do things like scaling and root planing and the use of the Periowave. Do we prescribe antibiotics as much? Not at all.
I'm really thrilled to hear you say that. But it sounds like you're also gaining some reputation out there in the marketplace.
Certainly. Periowave now is not just being referred from other practices because they know we have it. Patients themselves are finding out about it and contacting us and asking for the treatment. Our patients that we've used Periowave on, really all they have it done is once, and they want it done again because they feel the difference in their mouth. Their mouth feels healthier. They see the difference.
So you're getting patients that are actually coming back and requesting Periowave.
Definitely.
I think that sounds rather strange for patients to come requesting a surgical treatment.
Well, I mean, the fact with Periowave, we know that it's painless, it's easy to administer, and the results to the clinician, we see the results and we're thrilled with it, but the patients see the results too.
Are you finding that you're gaining more patients?
Certainly. In fact, right now, after 30 years, I have more patients than I know what to do with now, and always did. We always had a very busy practice, but I'm almost putting the brakes on a little bit because we're that busy.
One of the positive features that I'm hearing from the marketplace is that dentists are saying that they appreciate the fact that this is a technology that can be deployed by their hygienist. Mm-hmm. Is that of value in your practice to the dentist?
Certainly. You know, I work with a periodontist, and his best time spent is with a scalpel in his hand. When he's doing surgery, that's what he does. That's where his bread and butter. What the hygienists do are scaling and root planing, you know, the post-op work, and the use of the Periowave.
It sounds like over the last 5 years you found a lot more uses for Periowave.
And I think that's the case with many of the people that start with Periowave thinking they're only going to use it on their hygiene patients. And I've told you this many times too, one of the first few patients I used it on was a refractory patient. And refractory patients are those that there's nothing more we can do surgically. They have 8-9 millimeter pockets. They don't have any more surgical procedures that we can do or tricks up our sleeve. And I've been using the Periowave on them. Their tissue looks better. They feel better. For the first time, they're telling me that their mouth tastes better. So even though that was not actually the patients that we were required to use it on, it's the 4 to 5 to 6, 7 millimeter patients, amazing results on the refractory type cases as well.
So it sounds like you first started with the refractory problem patients and then moved on to a more general, well-utilized approach.
Exactly. Anything that has, or any area that has inflammation, bleeding, swelling, that's not normal. It's diseased. We need to treat it, and we can't just scale and root plane it. We're not doing enough anymore. And I think that's what we need to realize as clinicians. We need to add more to it because these patients are coming back in the 6 months or the 4 months or whatever the recalls are, and they look exactly the same. You know, we're not seeing results that we wanted to. By adding Periowave to it, they look healthier. And you know what makes them happy, the patients happy? We can extend their recall appointment. So those patients that used to have to see us every 3 months, we can see them every 4 months or every 6 months as things improve. That's a great selling tool and a benefit to not only the practice, but to the patients.
Saving them time as well as saving them money.
Exactly. And you know what? They look healthier. Isn't that the bottom line?
It's all what it's about.
Yes.
To learn more about how to get Periowave, please visit periowave.com.